Health Organization says that poor air quality could be killing up to 7 million people every year. When including issues like extreme heat, storms and floods, the casualties figures because of climate change would be staggering. Yet this is the first UN climate summit to include health talks on its thematic day's agenda. The WHO and many organizations are thrilled.
I truly believe that health can be a game changer for climate action because it matters to everyone. Our addiction to oil, gas, and coal is not just an act of environmental vandalism. From the health perspective, it's an act of self-sabotage.
So significant and important. I don't think Indigenous people around the globe have ever separated out climate from health. You know, if climate is good, then we get good health outcomes. So for us, it's a real acknowledgement of our ways of knowing, being and doing.
One of the aims of this conference is to include health actions in the National Determined Contributions, or NDCs. This is to ensure that not only health facilities save power and reduce their emissions, but to also regularly evaluate and measure climate progress based on human lives saved and health issues they face.
We have received 123 commitments from countries that are ready to sign the Health Declaration. It is a giant leap in the right direction. And of course, I continue to engage and I continue to ask many others to sign up. At COP28, I ask you to take the opportunity to make a real difference to the health of millions of people around the world.
I think nations' behaviour towards climate need to start in negotiation with health services, first and foremost, and be able to resource and plan with health services, and of course think about health workforce as well, because when these outcomes begin to exacerbate, these outcomes, poor health outcomes because of climate, it's our hospitals that are going to be seeing clients, it's our workforce that we saw in COVID that are going to be under that strain. So we have to plan now.
COP28 announced that giant philanthropies have pledged some $1 billion to scale up diverse support to national efforts in facing climate-related health issues. Health deserved to be on the climate agenda long ago. And as COP28 is finally recognizing that, the WHO has 3 recommendations. To accelerate phasing out of fossil fuel, which the organization says could save up to 1 million lives every year. It wants to build climate-resilient, low-carbon health facilities and to boost climate finances to the health sector. Adel El Mahrouky, CGTN, Dubai.